COVID-19 has greatly affected my work as a nurse. I'm now seeing people as potential carriers of COVID-19 rather than people. And I find this really upsetting because I didn't go into healthcare to have that view. It's been really difficult with COVID-19 because I'm working a lot longer hours and I'm working every day. Like the last couple of weeks I've worked every day, no days off. Yeah, so it's just been very full on, very stressful. So something that I'm finding is that a lot of people, a lot of patients are a lot more concerned about their general health and well-being than they normally are. Like it's a lot more panicked parents than we're used to. So it's a lot of counselling and discussing ways to reduce the risk of transmission. Yeah, I think one of the stories, like something that happened to me a couple of weeks ago, was I had a patient who was really stressed, and he was otherwise a generally very healthy man, but he came into the practice pretty much having an anxiety attack because all he's heard on the news is about how deadly COVID is. So actually sitting him down and explaining the facts was probably the best thing that anyone could have done. It just eased all his all his tension, and yeah, we were able to sort of tell him the reality rather than what we've heard on the media. So the main things everyone kind of already knows. So constantly be washing your hands, avoid touching your face because that reduces the risk of transmission. Social distancing is important, so staying 1.5 meters away, but also something that I find that very dehumanizing. So always try and just talk to each other and cheer each other like people, because it can be very isolating just being 1.5 meters away from everyone at all times. More than anything, I find it really sad. It's just, especially from the industry that I work in, I'm seeing the best and worst sides of people, where I'm seeing people really come together and support one another. And then I'm also seeing people on the other side stockpiling and stressing and only looking out for themselves. Biggest advice would be to just keep washing your hands, keep going with social distancing. Something that's really frustrating me is stockpiling. We don't have a surplus anymore. When you take more than you need, someone else goes without. And this goes for healthcare professionals as well. Like everywhere, hospitals, GPs, nursing homes, we're all running low on stock. We're running low on masks, gloves, hand sanitizers because everyone's stockpiling them. So when you buy more than you need, someone else goes without.